So when our nervous systems are basically in a state of balanced, sort of open, relaxed, the sensory input that comes in, the environmental input, the small stressors that we have in our daily life are not impacting us in a negative way chronically, right? That's on the left-hand side here. These things come in, there is no subsequent trigger. There is no storing that we need to then process and end that later, right? Like if you think of the trauma release technique, where people will then use the legs, I forget the TRE, I think it is, and then they say that that is very helpful, that shaking, right, is part of the mammalian release and processing of trauma. And so when we're just in a good state, it does not impact us that way. But on the right-hand side, if we are in a heightened state, right? Who's been in a heightened state and had a really loud sound and their body jumped? And it wasn't just, oh, that was just the door slamming. It was, okay, hold on. Now I need like 15 minutes to calm myself down, right? That is because we were already in this activated place. Whereas I would look at my kid when that loud sound comes, and generally he hasn't even registered it, right? He just was like, oh, a noise, I'm not in threat, it's fine. So we want to consider, of course, that the state that we're in and how the small things for ourselves or for our patients and clients are impacting us. And that will help to identify not just what our overall state is as far as activation, but also what sensory input, what sensory channel, which we have to consider now just based on what we went over last time. Those are direct communications to our gut, to our autonomic nervous system, and to our brain. So we want to sort of use those as clues. Okay, yes, I get highly startled, activated when there's smells or there's sights or there's sounds, right? Or there's touch, right? So any of those, and that gives us help to help guide people to understand, what somatics and what tools might be more useful. And so, that was to sort of to clarify this. And we're going to talk a lot this class about how do we use this in a room to help break some of those patterns that are happening in front of us so that more effective use of someone's time can be had, right? So just one more, this is the last one on the gut, the microbiome ones. But I love this chart, and I don't think it was in last week. And even if it was, I could look at this. I could teach a whole class just on this one slide. So at the bottom here, we do have the healed, sealed microbiome layers here, the gut lining. Everything in the immune system here is looking good. We have the ability to create new pathways in the brain here. We have normal cognitive function. The myelination on our sheaths in our brain are working. Our blood-brain barrier is closed, and there's not any neurological inflammation. What does that look like as an individual presenting, right? There's a sense of calm. There's organized thinking. There is the opportunity to shift between states and come back to a baseline, right? There's no what's called glial activation, microglia activation. Then on the other side, when the integrity of the microbiome barrier is impaired, we have the short chain fatty acids, which are needed for everything in the brain to function. We have altered metabolic function. And metabolic function is not just about how we digest or what our blood sugar is. That is how our brain is functioning, how we're sleeping, how our sugar, of course, and metabolism are working. Are we going up and crashing? Are we impairing our ability to sustain blood sugar so we're not having these mood swings, right? I mean, we've known for decades that, quote unquote, mood swings, what that is often associated with is sugar going up and sugar going down. You see it in kids for sure, right? Anyone who gave their kid 2 pieces of cake at a birthday party, you're going to see them go up and then come down real quick. But it looks very different in adults. It can look like agitation, irritability, anger, right? So then we come up here, disrupted immune function is what happens when all of this stuff comes through the intestinal lining. And then we have things like cognitive decline long-term, which are things like dementia, vascular dementia, of course, but we're talking about this brain fog that a lot of people seem to have, right? Or this diminished prefrontal cortex functioning, right? And so what happens as the prefrontal cortex goes, its activation goes down, it's slowed, its ability to inhibit the other parts of the brain, amygdala, overactive, fear, right? A lot of these other parts become overactive. So it is very clear that there is a connection between those. And then we have impaired blood-brain barrier, demyelination, which is where a lot of autoimmune diseases come in. And then we have general inflammation in the body and brain. And so when we talk about stress, is anyone familiar with the idea of hormesis? Hormesis is another way of saying stress, but hormesis is like the beneficial effects of stress. We have those, right? It's where like we might go to the gym and we tear the muscle and then we repair it, right? We get bigger muscle. And it's the same as when we give tools, no matter what our discipline is, and we ask people to do it again and again to build those neural pathways, to build those muscle memories so that we get a bigger beneficial effect. And so I just wanted to like note that even though all the things on the right might be wonderfully helpful for one person, we know that it's not for everybody, right? So physical activity can cause some people a lot of pain. Intermittent fasting, incredible for recovering metabolic function. But if done too fast or at the wrong time or with someone who food restriction is very stressful for, then we're going to have a different response in the body. Ketogenic dieting, we talked last week, it can even it can be 50% effective, I think, is the newest research on stopping seizures, absence focal seizures. But for some people, they feel much worse. Sleep, of course, always beneficial, but sleeping does not refresh everyone. Psychological stress, supplements, antioxidants, massage. I mean, all of these things are wonderful tools. How we use them and sequencing them are going to be different for each person. And so these are all things that I ask people to just look into for themselves based on whatever they have going on. But the key here is our metabolic resources, which it says at the top. If someone is saying that they're cold plunging, but they are still extremely stressed, sometimes it's because that cold activation is too much for their sensitive system. And so it's going to have a back effect, right? I have a dear friend who has been in this field as long as I have, and she was doing infrared sauna. She started off with a bang because more is better in her mind sometimes. And, she basically had an event that was very scary, because just a little too high, a little too long in the beginning can push a system past this hormetic effect and into a damaging physiological state, okay? And then it takes time to recover from that. I'm sure we all know people who they haven't been exercising and then they finally feel good enough to exercise and they go out and then they crash for months afterwards, right? Those are autonomic states that we're not prepared for that amount of stress. So everything I suggest is always low and slow, right? Even with the microbiome mashup, which I talked about last time, the general recommendation by Dr. Karazian, he says, do 1 to 2 tablespoons a day. Yes, and start with 1/8 of a teaspoon as far as I'm concerned. Chew it extraordinarily well, make sure that it aligns with your system. Try that for a couple of days and then slowly start to work yourself up. And that's just food as medicine, right? But fibers affect everyone differently. You're going to start producing more short-chain fatty acids. It actually changes the brain when the gut is getting fueled differently. So these, even though these seem like small interventions that wouldn't really do much, they're actually profound medicine.